Good afternoon. I am Lauren Jones. I am the Patient Safety Specialist here at Lake St. Louis, and today I'm going to talk to you about safety culture and what that means to SSM Health and our ministry as a whole. So safety culture, it is defined as the way in which safety is managed in our workplace. As a team, we kind of guide that. We guide how we want our safety culture to be, and it is through influenced by our beliefs, our values, and our attitudes of the employees towards safety. This wheel here kind of shows you all the different things that go into promoting a healthy safety culture. That includes teamwork, safety rules and procedures, organizational learning. We have our workforce involvement, our management commitment to safety, and our adaptability. It's important to be adaptable because as we look through our processes here at the hospital, we sometimes find where our gaps are. And when we find those gaps, it's important that we can change those gaps, like mitigate those risks that we have. And by doing that, we have to be adaptable. We have to be okay with change and knowing the why behind the change. So adaptability is huge when it comes to promoting that safety culture. One of the things that we'll kind of focus on here is event reporting. We do have an event reporting system here with SSM, and it is located on our intranet page. It's super important that we report any events that happen with our patients, our visitors, and within our employees, and those all can be found in the same place. For our patient safety event reporting, we want to make sure that we are putting in any event that could be a near miss, something that almost reached the patient but didn't. Those are important to capture as we find our gaps there, and we can prevent any occurrence to our patients. So currently here in our hospital, we harm one patient every 91 days. So what that means when we look at that harm is significant harm. We're not talking about our patients who maybe have had a fall and had a skin tear. That is harm, but when we look at this number here, that number harmed, we're looking at significant harm. So did we cause harm where they had to be in the hospital longer due to that harm? Did they fall and break their hip? That's going to be something that goes into that number. And this number here, that 91 days, is in a rolling 12 months. So that will change on a monthly basis as we get more numbers in. And so right now it says 91, and I do believe for the month of August, we are at 128 days since that we harm patient number 128 days. Some of the things that we look at, some of our top event categories that I see are treatment and care, our medication and fluid errors that we have, inpatient falls, and specimen labeling. Medication and fluid events, those are typically a lot of our near miss events. Our pharmacy has a really good job of identifying gaps that didn't make it to the patient, but if they would have, they could have caused harm. So we really encourage everybody that we place those events. That way we can look, so Tyson and his team can look at, okay, why did that almost get to the patient, and mitigate those risks. Other near miss that can happen are if you have a patient who is supposed to be on thickened liquids, however, they somehow got thin liquids sent up from the cafeteria. We want to report that because there was a gap in the system, gap in our process that allowed that to get to the patient. So that way their manager can kind of go back and look at the event itself and how did that happen? Was it a brand new employee? Was it somebody who wasn't paying attention or didn't look at the proper patient, had the wrong patient pulled up? So those are all things that we can look at with our near misses. And really our goal is to identify and remove any barriers or gaps in patient care. Through our near misses, we get a lot of our great catches. So here at SSM Health, we do have a great catch award that we give, and that is a program that fosters a culture of safety by training and encouraging staff to recognize and report risk before it happens. And this typically isn't something that's already built into our process. It's typically something where I caught and prevented the harm. It wouldn't be something that I would catch on my daily routine, but I went above and beyond for that. So that's really our great catch, and we do a lot of great catches here at our hospital. So next, I just want to bring up this little paper here. So this is just kind of our event reporting system. So this little icon you can get in, and it'll take you straight to these PowerPoints here. But really, this just shows you exactly where you can go to get to enter events. So you go to our intranet page, and you just go down to report an event. At that point, it will open up, and you can report anything from a patient, a visitor, employee event, workplace violence, all on the same page.